Assalamu alaikum. Good evening to everybody, or good morning, or good afternoon, wherever you are joining us from different parts of the world. A very warm welcome to you. I'm Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health and also an Associate Professor of Clinical Population Health Sciences here at Weill Cornell Medicine-Qatar. So we welcome you today to the Health and You Community Wellness Series. As you all may know, the overall goal of the series is to create community awareness about health and disease. And the ultimate objective of the series is really to enhance self-care. We want to reduce suffering, improve the quality of life, and increase healthy longevity. Just some housekeeping. Your cameras and microphones are turned off. Please use the question and answer feature to type questions and comments. Questions will be addressed at the end of the session. And just a reminder, this is not a CME CPD activity, so no certificates of attendance will be issued. So we have a very exciting talk today happening. As you can see, the title of the talk is Chest Pain, the Basics. And the talk will really focus on the causes of chest pain, and what it is that chest pain really is about. So again, as we know, the cause of chest pain may be nothing more than indigestion. It could be muscle strain or some other innocuous problem. However, it can potentially point to a more serious and life-threatening cause, such as a heart attack. Now, this session will review the potential causes of chest pain and when to contact a healthcare provider for help. So today's expert speaker is Dr. Islam Elgendy. Dr. Islam Elgendy is an interventional cardiologist with an interest in vascular disease in women. He's an assistant professor of medicine here at Weill Cornell Medicine-Qatar. He completed his residency training at the University of Florida, Gainesville, Florida, and his fellowship in cardiovascular medicine and interventional cardiology at the same institution. He subsequently also completed an advanced fellowship in vascular medicine and intervention at Massachusetts General Hospital and Harvard Medical School. He's board certified in internal medicine, cardiovascular medicine, and interventional cardiology by the American Board of Internal Medicine. Dr. Elgendy is an outcomes researcher. He's an author of more than 300 peer-reviewed manuscripts published in high-impact cardiovascular journals. He also serves on the editorial board of many cardiovascular journals. So Dr. Islam, over to you. A very warm welcome to you.
Thank you so much, Dr. Shima, and good afternoon, everybody. It's a great pleasure to have you join us this afternoon. And today we will be talking about chest pain. What are the potential causes of chest pain, and what are the when and why to worry about chest pain, and when to seek medical advice. So I do have these disclosures that are not relevant to this talk. I do receive some consulting fees and research support fees from a biomedical institute. So chest pain, why is this topic important? So as some of you might already know, there are many problems or diseases that cause chest pain. Not all of them are serious, but the problem with chest pain is that it might be an indicator of a serious condition, such as a heart attack. So what are the general causes for chest pain? First of all, I will discuss the common causes related to the heart, and then we'll talk about the other causes. So the most common or serious causes of chest pain related to the heart is what we call angina or coronary artery disease. We use the term CAD for shortness. So if you look at this diagram here, this is a sketch diagram of the heart. The heart is 3 layers: the internal layer, then the middle layer, which is the thick muscle layer, and there's a thin sac layer that protects the heart. Within the muscle layer lies the arterial blood supply of the heart muscle. Now, this is how the heart artery, or what we call the coronary arteries, look like when we take a slice or look at it interiorly. So as you see, the lumen should be nice and clean, and the blood flows through the artery and it goes to the muscle to supply the muscle. Now, in patients who have coronary artery disease, there is some deposition here of plaque or lipids. It comes from the bad cholesterol. It starts collecting in the internal part of the artery. It builds up until it starts occluding or blocking the flow of blood within the artery. Now, most cases of this occlusion, when it's mild or not bad enough, it usually doesn't cause any symptoms. Now, patients start suffering or having symptoms when this blockage becomes more and more progressive. And this is what happens when patients have coronary artery disease or angina. Now, if this whole artery occludes because of this plaque occluding the entire artery, that's when a patient has a heart attack. Now, you can see having some blood flow, even if it's minimal, still is not a medical emergency. However, once this artery is completely occluded, that's when a medical emergency or heart attack happens. Why is that? Because there is no longer supply of blood to the heart muscle. So these are the two most important causes that I would like you to take home from today's lecture. Now, there are other causes that cause chest pain related to the heart. If you remember, I told you there's a small thin sac that covers the heart muscle, or what we call the pericardium. That could become inflamed because of viral infections. And if that happens, it's a condition called pericarditis. Now, that's not as serious as a heart attack. However, the chest pain resulting from pericarditis can be discomforting and agonizing to many patients. Now, another serious condition that might cause another serious cause of chest pain that's related to the heart is what we call aortic dissection. If you look at this diagram again, this is the heart, and coming out of the heart is the major blood supply or the blood vessel that gives supply to the entire body. It's called the aorta. If a tear or injury to happen to the wall of the aorta, this is what we call aortic dissection. It means that the aorta has a tear. If that happens, it will cause severe agonizing chest pain. And that, again, because there's a tear of the major blood supply to the entire body, that is, again, a major serious cause of chest pain. So as you see, there are important causes of chest pain that some of them are life-threatening, such as heart attack and aortic dissection. Now, there are other organs within the chest cavity that can cause chest pain if there's a problem. Now, if a patient develops any sort of trauma or injury to the chest wall, which is the cavity around the chest surrounding the heart and lung, the patient might have chest pain. Now, if there's inflammation of the muscles and grips or the bones of the chest wall, the patient might have chest pain, or what we call costochondritis. Now, within the chest cavity runs another organ, which is the esophagus, and this is a tube that connects the mouth to the stomach. If there is reflux of acid from the stomach into the esophagus, which what we call gastroesophageal reflux disease or indigestion, the patient might experience chest pain. Other causes are related to the lung. If there's an occlusion in the blood supply of the lung or a blood vessel of the lung, this is what we call a blood clot in the lung or pulmonary embolism. Or if the sac around the lung is inflamed or has another disease process, the patients might develop chest pain. So as we see, there are several causes of chest pain. Some of them are serious, such as the heart attack, aortic dissection, and most of the cases or the other causes are not as serious. So since there are serious causes for chest pain, which is the heart-related chest pain or the heart artery occlusion chest pain, it's important to recognize some features of that type of pain. So oftentimes the patients who have coronary artery disease will tell us that the pain is squeezing or pressure-like. They will describe it as something sitting on my chest, or an elephant sitting on my chest, or I can't breathe because I feel like a huge rock on my chest, or somebody squeezing my chest around me. Most patients who have this type of pain would say that the pain is located somewhere in the middle side of the chest, or often side on the left side. And sometimes they feel it in their jaws and left arm. They oftentimes describe that the pain gets worse when they exert themselves or they're under stress. And what they also notice that the pain gets better with rest. Now, these are the characteristics for what we call the cardiac or the typical chest pain. And this happens with patients who have coronary artery disease. So the patients most of the time can predict what sort of exertion or stress that brings the pain on, and they know with time what makes the pain get better. Now, how do we know that this pain is not just coronary artery disease or angina, but rather is related to a heart attack? Before we go into that, I would like to summarize to you what coronary artery disease or angina means again. So this is another figure of the heart artery. And as we see, there is some deposition of the cholesterol or the lipids in the wall, obstructing the blood flow. So it impedes the blood flow to the heart, resulting in the narrowing of these arteries. Most common symptom, it causes chest pain. And this is the most common type of heart disease. Why is this important? Because it results in a large number of patients dying from this disease, especially if it's left undiagnosed. In the United States, it kills close to 400,000 people a year. So what can we do to prevent coronary artery disease? So if you remember, coronary artery disease is because there is some lipid or cholesterol in the wall of the artery that shouldn't be there. So there are some things that we can do and advise our family and close friends to do in order to reduce their future risk of developing this condition. It's a very common. So by adapting some healthy lifestyle options, we can minimize the risk of developing this disease. First of all, if a patient smokes, we advise them to stop smoking and support them and advising them and providing them with the support to stop smoking. We all the time advocate and advise people to eat healthy, meaning using what we call the Mediterranean diet, which is low in cholesterol and sugars and plenty of fruits and vegetables. And to try to exercise regularly, meaning if somebody who is living a sedentary lifestyle or does not do any sort of activity, if they go outside and walk 2 or 3 times a week, even for a short period of time, that will help them reduce the risk of coronary artery disease. And if the patient, his body weight is excessive, we advise them to start losing weight through, again, the healthy lifestyle, eating more fruits and vegetables, and by doing or introducing exercise to their daily routines. Now, if the patient does develop coronary artery disease, what we don't want happening is that the patient has a complete blockage of the artery and developing a heart attack. So what we do is that we, again, emphasize on the lifestyle changes. So if the patient didn't start these things and now develops coronary artery disease, we re-emphasize on these things. If they smoke, we advise them to stop smoking. If they're not eating healthy, we re-educate them on the healthy habits of eating and exercising. Now, there are certain risk factors or other diseases that increases someone's risk to developing coronary artery disease and subsequent heart attacks. Those include high blood pressure, diabetes or high blood sugar, and high cholesterol level. Now, if we know a patient has any of these conditions, we try to treat those and adequately reduce their numbers. That, again, helps them reduce their risk of coronary artery disease. Or if they develop coronary artery disease, it reduces the risk of developing heart attacks. So how about a heart attack? A heart attack, as I said, it's the artery now is completely blocked. There is no blood flow to that area of the heart. This condition affects about close to 1 million patients in the United States. In the United States, it's encountered that approximately every 40 seconds, somebody has a heart attack. So it's an extremely common condition. It's lethal if patients do not seek medical advice. And that's why it's very important to prevent it. Most important thing about heart attacks, it's preventable. So now, as I described to you, the typical or what we call the common cardiac chest pain, most patients who have coronary artery disease experience it and know the type of pain they are experiencing. So when do we advise patients to seek medical attention or call an ambulance? If they notice that the pain is new or worse than they're used to, if it comes with shortness of breath, if the patient is experiencing with the chest pain trouble breathing, and it lasts more than usual. As I said earlier, Most patients who have coronary artery disease know how long the pain lasts and what makes it better. Now, if the pain lasts more than usual, that might be an indicator for a heart attack. Now, if the pain doesn't seem right and it scares the patient or worries them, that's again another indication that this might be a heart attack and the patient should seek medical advice. Now, if you know or suspect that somebody might have a heart attack, it's almost always recommended to call 999 here in Qatar or seek an ambulance. Don't drive the someone you love or someone you know suspect that they might have a heart attack to the hospital. The reasons are twofold. One, if the emergency medical team are equipped seeing these patients, they can start treating the patient while in the ambulance until they get to the hospital. And because heart attacks are lethal, these patients might develop some complications from the heart attack. Again, the emergency medical team are equipped to treating those complications. So what happens if a patient comes to the emergency department with what we suspect as a heart attack? They get some basic tests. One of them is called the electrocardiogram or an ECG. And this is like how this picture shows. It's an electric heart tracing. There are multiple electrodes that are connected to the chest wall, arms and legs of the patient, and it gives us an idea of the electric tracing of the heart. By reading it, it helps us to identify whether the patient might have a heart attack or not. To confirm whether the patient has a heart attack or not, we also order some blood tests, and oftentimes we do some imaging tests beside electrocardiogram for the heart. Now, if we are strongly suspecting that the patient has a heart attack, oftentimes before they leave the hospital, they undergo a simple or a mini invasive procedure called cardiac catheterization. By doing so, we look in the arteries of the heart with a small catheter, and we identify if there's an obstructed or occluded artery. And if that is the case, we open up the artery by putting a stent to open it up. So what if somebody you know or a family member had a heart attack? What are the things that this patient should do after having a heart attack? First of all, as I said, they should, if they didn't start a healthy lifestyle, they should start adopting it. Now they need to understand, or the patient who had a heart attack understands that they are at higher risk than the general population of developing a second heart attack. And that's why it's very important for them to take their medications. And if they have risk factors for heart attacks, as I said, like high blood pressure, high blood sugar, high cholesterol, that should be treated as well. Now, a cornerstone to reducing the risk of future heart attacks or progression of the disease is by exercise. Now, if a patient has a heart attack, we oftentimes introduce exercise to them in a controlled setting under the care of some of our physical rehabilitation team, or what we call cardiac rehabilitation. It's a program for a few weeks where we supervise their exercise, make sure they can tolerate it, and then we advise them or educate them on what type of exercises they can do after they leave the program. Now, it's very important for somebody who has a heart attack to have always an emergency plan, like to have their medications, a list of their medications listed, the type of procedures that they had, because oftentimes if they develop a subsequent heart attack, they can refer to this document or paper and bring it with them to the hospital. And that's very helpful for the physicians who are taking care of him or her. And thank you very much for your attention. I'll be happy to take any questions.
So thank you very much, Dr. Islam, for that. If you can stop share. So I know people are going to start posting questions and I can just start sharing those with you. So Dr. Islam, I think I would just like to start with the first question. You know, of course, you gave us a great talk and you spoke about some of the things that we can actually do to prevent heart attacks, right, from happening. So what do you see in patients, you know, when you tell them, or what can we tell our community? What is the biggest challenge that you see in people when we tell them, you know, to make some of these lifestyle changes or some behavior changes? Can you talk a little bit more about that, or how do you motivate them to make those changes so that they can actually prevent, or even in the future, you know, prevent it from reoccurring?
So, as you correctly highlighted, it's oftentimes a challenge to introduce to the patients to change their habits. It's extremely difficult. So oftentimes what we do is to introduce them to videos or give them some brochures to read about heart attacks and how people's life changes after heart attacks. And how by adopting this such healthy lifestyle could help them lower their risk. Now, up to 85% of the cases of coronary artery disease or heart attacks are preventable. And that's why 50, 60 years ago, we're not seeing as many heart attacks. It's all because of the diet changes and how the sedentary lifestyle has become part of us. People didn't have diabetes as much or hypertension 70, 80 years ago. So by educating patients on how these differences could impact their lives, some people are more receptive to others. And if somebody is receptive, we give them more information and keep encouraging them. Now, if somebody is not receptive to the idea of changing, oh, doc, I'm feeling fine. I don't have any problems. I don't see why you're worried about me. We just reemphasize each time we see them. Remember, this is something that we can prevent. It's the most common cause most people die in the Western world. By introducing these changes, we can help you lower your risk.
Great, thank you, Dr. Islam, for that. So Dr. Islam, just again, going back to the point of how do you differentiate? I know you'd mentioned on a couple of slides, how do you maybe differentiate, if you're really having chest pain, or is it maybe just reflux disease, or just a muscle strain which is happening? If you could just reiterate a few of those points for our participants, please.
Sure. So the characteristics of a heart pain is how I described it. It's usually something in the center of the chest. It's like a squeezing sensation. Typically, it lasts at least 5 minutes. Sometimes it radiates somewhere else, like the neck or jaw. And most of the cases are brought off by stress or exertion. And it typically goes away unless it's a heart attack. Now, indigestion is usually in the lower part of the chest. It's coming from the stomach. It usually happens after a heavy meal. Patient oftentimes feels some nausea and vomiting. And it's not related to exertion. And most of the time, it doesn't radiate either to the neck or the arm. Now, chest pain usually is localized, meaning that the patient can point to us, this is where it hurts me, doctor. When I take a deep breath, it gets worse. This is not typical of a heart-related pain. The heart-related pain is mostly diffuse. It's a squeezy-like sensation. The patient oftentimes can't even describe where it's coming from. It's somewhere here. And it doesn't get worse with a deep breath. Now, sometimes ourselves can differentiate between both types of pain, and we have to order some tests. So if the patient is worried enough, this is not something I'm used to, we almost always advise them to come to the hospital, get checked out. It's better to be safe than sorry. If you miss a heart attack, it's fatal. Just coming to the hospital, getting a checkup and going home, it's much, much safer.
Absolutely. Thank you very much. That's fantastic advice. So Dr. Islam, can you talk a little bit, is it more common in males or females? And also if there is a genetic component, to heart disease?
So as I said, 80 to 85% of the heart disease problems are preventable. So there's this 10, 15% component that we're not sure where it's coming from. Some, yes, is related to genetic disease. So some families tend to have a higher tendency for heart artery disease blockage. It usually happens at a younger age. So these families would have heart attacks at the age of 30s, 40s. The common age group to see heart attacks is usually in males after 50, in women slightly older, because they have a protective effect of the hormones. Now, the question whether it's common in males versus females, we used to teach all the time that this is a disease of males. But now when we're seeing the longer lives that patients are living, we're seeing more heart disease in women. So after the age of 60, it's almost the same. Men and women have the same prevalence of heart disease. So if a lady comes with these symptoms, we shouldn't ignore it, because most of the time women get ignored. Oh, she might be stressed, or might this be, not this. And we always think heart disease is a male disease. That's not true.
Okay, thank you. So Dr. Islam, another question about stress. Is stress a major factor in causing heart attacks?
It's not a major factor, but it's a precipitating factor, meaning that if a patient is stressed, that's more demand on the heart. So if there is a heart artery disease blockage already, the stress might precipitate a heart attack. So it's not the reason why the patient developed a heart attack, but is a factor that would predispose the patient of having a heart attack. Now, I know it's almost impossible for somebody to have a stressless life. So we learn how to cope with stress, especially patients who had a history of heart attacks. We always encourage them, try to meditate as much as you can, remove try to live with the stress, remove the stressful factors as much as possible.
So maybe talk a little bit more about that, Dr. Islam, about how can they use some of these strategies, to reduce stress? Like you're saying, stress is part of our lives. So can you talk a little bit more about these strategies that people can inculcate in their day-to-day lives, and even if there are stressors, how do they sort of, try and manage those?
So one thing I almost all of the time advise my patients to do is meditation. So if you can find 5 or 10 minutes at the end of the day, after the kids are asleep, you're done with your work, everything is done, just close your eyes, sit down, relax for 5-10 minutes. That 5 minutes helps to alleviate a lot of the stress during the day. Now, another thing that I found a lot of patients receptive to and would come and tell me, yes, that's true, is exercising. Now, I know I'm guilty myself. I'm sure others are. We don't have the time to incorporate exercise as we should. And oftentimes think of exercise as a burden, as opposed to something helpful. But the truth is, once you incorporate some dose of exercise, like even a few minutes per week, that takes a lot of stress out of the week. Just going out for a walk in a park for a few minutes, now with the nicer weather, it's a good opportunity to incorporate that in once every few days.
Sure. And again, like you're saying, Dr. Islam, so I think we can try and also just, do some more movement. If we're talking on the phone, we can just be, taking some steps. If we have
Absolutely.
stairs in the home. So I think we really just have to find ways of movement. Like you said, the term exercise, I think always just sort of puts us away, or we never have time. So I think it's also more about just getting some movement, more movement, and shift away from our sedentary lifestyles. Dr. Islam, another question about if heart disease has happened, right? So is there a way that it can be reversed? Are there any studies?
If there is any evidence of heart artery disease blockage, unfortunately, it's not reversed. But what we can do is lower the risk of that to get worse or to develop a heart attack. And that's what we do with medications and lifestyle changes and improving the risk factors. As I said, if a patient does have high cholesterol, high blood sugar, high blood pressure, we treat that, treat the heart artery disease blockage typically with aspirin and cholesterol lowering medications, and encourage the patient to incorporate a healthy lifestyle. That standalone would reduce the risk of progression of the disease. And if the patient did have actual heart attack, it would reduce their risk of developing a subsequent heart attack.
Great. So just as a follow-up question to that, what is the role of aspirin? Does it prevent heart disease, or what is the role of aspirin?
So aspirin, I would say there has been a lot of advocacy in years for aspirin to lower the risk of heart attacks. Now, what we did know from studies in the past 3 or 4 years is that aspirin does not prevent the risk of heart attacks. However, if the patient does have evidence of heart artery disease blockage or coronary artery disease, in this subset of patients, yes, aspirin reduces heart attacks, but not for the general population. What we had seen up until 5 or 6 years ago, a lady who's 67 years old with just high blood pressure, she would be on aspirin to reduce her risk of heart attacks. That has been shown not to be helpful, but in fact, even increases the risk of bleeding.
Okay, so I think we have another great question, that if we suspect somebody is going to have a heart attack or maybe is having a heart attack, what measures can we do? If we see a loved one, a friend, or a colleague, and we think that they're having, while we call, and we are waiting for the ambulance, what is it that we can do to help them?
So if you're thinking that somebody has a heart attack, just and they do have the history, you can give them aspirin. That's one thing that can always be done to lower the risk of somebody dying if they are having a heart attack.
Okay, and I think like maybe people, you know, see in movies and videos, like, you know, somebody, they feel somebody's having, should we start CPR? I mean, again, I think people might be thinking of that also. So what would you suggest, or what kind of training can people get?
So
You know,
CPR should be only initiated once a cardiac arrest happens, like if the patient becomes unresponsive. Now, if they're only having chest pain, starting CPR is not helpful because their heart is still pumping. So
right.
yes, if the patient is complaining of chest pain or had been complaining of chest pain for some time, and all of a sudden becomes responsive, absolutely, we should start CPR, call for help as soon as we can.
Great. Okay. So there's another question about, does pregnancy increase the risk of heart attacks? And if yes, what intervention can reduce the risk?
So pregnancy does not increase the risk of heart attacks. Now, during pregnancy, the lady might be more susceptible to what we call artery blockages in general. Most commonly, what we see is lung artery blockages, or what we call pulmonary embolism. But that, again, is not common.
Okay, so we have another question. Can limited sleep lead to any heart disease?
So not heart disease in general, but having a long time of limited sleep, that is a risk factor for developing, or what we artery disease blockages, whether that to be stroke or cardiovascular disease in general. So yes, some studies have shown there might be an association between not sleeping less than 5 hours a day for many years and developing subsequent strokes and heart attacks.
Okay, great,
But
thank you.
compared to the other bigger risk factors, such as heart, hypertension, or high blood pressure, high blood sugar, this is a very negligible risk factor. So if a patient has these risk factors, we would focus on these first.
Great. So there's another question about, what is the most sensitive test to confirm a cardiac attack or heart attack? If there are no typical signs, and even if the ECG is normal, does that happen? And what is the most sensitive test to confirm that?
So the first test that we do is the ECG. Most of the time, it will pick up that the patient has a heart attack. Now, there's some patients who might have a normal EKG, but their symptoms are still suspicious. Those patients, we will order some blood tests. They give us some idea if there is a heart attack or not. And if we're still suspicious, we sometimes do what we call an echocardiogram, which is an imaging study to look at the heart muscle. Again, that will help us guide us whether there might be heart attack or not.
Thank you. Another question that I think it relates to your answer about giving aspirin, like if we feel that a person is having a heart attack. So in case, you know, we don't have aspirin available, you know, then what should one do? Just wait for the ambulance to arrive? Or is there anything else we can do to help alleviate the pain?
So the most important one is aspirin. Some patients who have a history of CAD or coronary artery disease, we oftentimes give them what we call nitroglycerin, which is a medication that's given under the tongue or a spray. It helps relax the arteries of the heart and helps with the pain. If this is available to somebody, yes, they can take it, provided that their blood pressure is not low. By low, I say not lower than 90/60.
Great. So another question about, is there any relationship or have you heard or seen studies where they say that more of these heart attacks, they happen in the morning? Is there any evidence available?
Well, there is some limited evidence to suggest that heart attacks happen in this early part of the morning, meaning somewhere between 12 to 4 a.m. It's some theories behind that is that the cortisol level of the human body is higher during that time, right before we wake up. So that's an additional stress factor on the body, but it hasn't been solid concrete. Like a lot of time we see patients coming with heart attacks in the afternoon, early morning, in the evening. There's no particular timing. So it can happen 24/7.
It can happen 20. I think that's the key message that people need to just keep with them, right? That can happen anytime. So there's a question about, I think, related to COVID patients. Who may be above 60, male or female, should you prescribe aspirin if they have one or more risk factors, like if they have high blood pressure, like to prevent heart attacks? Can we would you recommend giving them in
So as I
post-COVID
said earlier, if the patient doesn't have history of a heart attack, or we did not confirm that they have heart artery disease blockage, aspirin is not helpful. It doesn't reduce their heart attack risk. Now, if we do see that they have evidence of heart artery disease blockage or CAD, yes, we start those patients on aspirin. If the patient just has high blood pressure, diabetes, high cholesterol only, we don't start aspirin. I know it's a practice that has been going around for many, many years, but there's many, many studies that refuted the benefit. In fact, it showed aspirin for these patients might even be harmful.
Great, thank you very much. So Dr. Islam, if you can just reiterate, I know you already shared some slides about, what can we do to prevent? So can you please just reiterate some of those points again? Because again, those are very important and we do have some questions regarding that. So how can we avoid these heart attacks? And please just reiterate some of the preventive measures we can take.
Number one, the risk factors. If a patient does have, he or she, high blood pressure, high blood sugar, high cholesterol, I would work on reducing that, take the medications correctly, and follow up with my physician regularly to make sure that these risk factors are controlled. If a patient, he or she, is overweight, I would start working on reducing my weight. Adopting healthy lifestyle, this is the key. Introducing more fruits and vegetables in our diet. We are all guilty of this. We are all find it easier and more convenient just to go to a fast food restaurant, get something to eat for lunch because we're all busy all the time. Same for dinner. We just finished work. We'll get something from anywhere and just eat it in the car. Doing this on repetitive basis, this is just increasing everyone's risks for heart attacks. So take the extra effort to help protect yourself and your loved ones by eating more fruits and vegetables. Try to introduce a portion in each meal as a starter. Now, if somebody like myself is doesn't have the time or doesn't find the time to exercise, few steps, one step at a time. Try to make it something part of your habit on a weekly basis. By doing these measures, you would reduce yourself and your loved ones' risk for developing a heart attack significantly. And as I said, 7 years ago, when people were all active and there wasn't as much diabetes and hypertension, we're not seeing as much heart attacks. It's a disease of this century. And unfortunately, it's killing so many people and they're dying so early because of it.
Right. So Dr. Islam, maybe just talk to us a little bit about, if we are able to get the person in time to the hospital, what are the chances of recovery and how well do they do?
So if the patient with a suspected heart attack comes early, we're most of the time successful. If we identify that they have a heart attack, we take them to the cardiac catheterization lab. We see where the artery is blocked and we put a stent, we restore the blood flow so the patient will have normal blood flow. And if we do that in a timely manner, we can save their lives. And in terms of numbers, we would reduce their risk of dying from a heart attack by 50–60%.
Great. Thank you so much, Dr. Islam. So I think you answered all the questions. It was a fantastic presentation. Can you just summarize or just give some key tips that people can take away with them today after listening to your session?
So I would say chest pain is a common symptom. It's not always caused by heart attacks, but heart attacks is why we worry about chest pain. If you're suspecting you or your loved one might have a heart attack, call the ambulance, get medical attention right away, because every minute really does count. Maybe a patient is having chest pain for 2 hours and all of a sudden they collapse and die. You don't want to lose somebody because of delaying their appropriate treatment. The key important thing that I would like you to know from today's lecture is that heart attacks are preventable. 80–85% of the time we can prevent them. It's just we need to work harder ourselves and work with our kids, families to incorporate a healthier lifestyle, identify whether we have risk factors for it or not, and correct and treat those risk factors.
Great. I think that's great advice and great tips. So inshallah, we can all follow the tips that Dr. Islam has given. We can prevent heart attacks. So I think that's a key message. So let's focus on self-care. Let's look after ourselves, let's love ourselves, plus all our families and friends, and take that message forward. So thank you so much, Dr. Islam. It was wonderful having you with us. And I'm sure our participants have also benefited much from your talk. My gratitude to all our participants who joined us from different parts of the world.